Richard, welcome. You are CEO of Sana Health. Tell us about it. What is your moonshot?
Thank you. Pleasure to be here. Our moonshot is to end chronic pain by 2030.
Wow.
So if you divide up pain between acute and chronic, acute is the signal that's coming from your brain, and chronic is how your brain then adapts to that signal to then exacerbate that pain over time. And we believe we can undo that chronic element of chronic pain.
That's very exciting. So, and lots of people have worked in pain and tried. So tell me what's your approach and how are you going to be different?
Yeah, so I had my original injury in the Yemen. I was driving down a road in a Jeep. I had a choice of a head-on collision next to a petrol truck or to go off a bridge. Went off a bridge, 60 foot into a riverbed, car crumpled up like a Coke can, and spinal injury T8-T10 and a ripped aorta. 4 days later in the UK hospital, I then was clinically dead for 8 minutes, coma, came back from that.
Oh my God.
And all of that resulted in a nerve damage pain problem that was so severe I was given a 5-year life expectancy.
Wow. How long ago was that?
That was 1992.
Oh, good for you. All right.
So by 1993, and standard of care is the same 27 years later.
Wow.
Medtronic and Abbott will claim that their internal spinal cord stimulators are a lot better than they were back then. There's not a lot of evidence to suggest that that's correct. But basically, standard of care is opioids, gabapentin, internal stimulators, external stimulators, and then eventually meditation. And what I realized was that with pain levels at 20 and meditation ability at 0, you can't get there without help.
Yeah.
And so I studied the work that had already been done on long-term meditators. I realized there was very specific frequency patterns in the brain that they were producing, and I set about hacking that. So what we've ended up with is neuromodulation using light and sound that produces those frequencies that you have if you've been meditating for 20 years. So this is the current version of the device, and you have light coming through closed eyes and sound through your ears.
How often do you wear it, or for how long do you wear it?
So now I'm a health and wellness user because it totally fixed all of my underlying pain.
Fantastic.
We've just done a fibromyalgia study where we told people use every night to help them go to sleep, and then during the day, whenever any of their symptoms, so pain, depression, anxiety, fatigue, when any of those are too much for them to enjoy their life, use the device. So they started using 5 times a day, 15 minutes a time, and then at the 6-month mark, they were down to once a day, maintaining all of their the 50% reduction in symptoms by using once a day.
And so this is a clinical trial you did?
Yeah, so that was a 20-person clinical trial. We've got a 120-person clinical trial on fibromyalgia coming up with Duke this year. And then we've got Mount Sinai, who've already started a neuropathic pain study. Cleveland Clinic are going to run a multiple sclerosis study on multiple sclerosis pain.
Yeah.
And then Walter Reed is going to do a lower back pain study.
Very exciting. How did you come up with the right science behind this? Or
Well, really, it was trial and error. Once I had the blueprint of these are the frequencies that a long-term meditator has, the other thing that was critical, which actually means that you can only do this with audio-visual stimulation, is that they had all the long-term meditators had perfect symmetry between the left and right-hand side of their brains at the frequencies between 1 and 30 hertz. And I was looking at my brain in the same system, and my brain was massively skewed to one side rather than the other. At the time, I didn't know, and I frankly didn't care, but that was everyone else in chronic pain. I just was like, okay, this is mine, this is what I need to get to.
Yeah.
And then once I'd fixed myself,
Yeah.
and I haven't had a minute's nerve damage pain since 1993, I was like, okay, so I really have fixed myself.
Yeah.
Who else can I help with this?
That's
And
amazing.
so that's been it's been 27-year journey since then to how can we roll this out to help other people. And the biggest problem we had was the original design was all worked out on EEG. And there was no wet electrode at home EEG that's ever succeeded. Muse is the best dry electrode system, and it's great for meditating,
Yes.
but it doesn't tolerate movement.
Unfortunately, we have to stop, but I'd love to hear more of this story because it's so fascinating. But good for you for doing this. Congratulations, and I
Appreciate it.
wish you the best of luck with this company.
Thank you very much.
Okay, thank you.
Have a good day.
Thank you.